Hi, my name is Nick, and this video is to describe patient etiquette. So, for starters, when you're a volunteer and you're a patient advocate, patient activation liaison, PAL, you want to make sure you dress well when you come in. For men, this means khaki pants probably and a collared shirt. I wouldn't wear blue jeans. I don't think you should wear sneakers. If you're a woman, you should probably not wear anything that goes above the knee, and you should probably wear a blouse. You just want to show in your dress that you respect the person that you're talking to. And then the next thing to do is to know when not to enter a room. So you don't want to enter a room if the patient is asleep, and you don't want to enter the room if the nurse is in there with the patient, or physical therapy is in there with the patient, or any other healthcare provider is in there with the patient. So everybody else, you would knock on the door. And what I recommend you do before you go in the room is read the header and the footer on the patient encounter form. You're going to make sure that you sanitize your hands. So when you introduce yourself to the patient, you say, "Hi, my name is Nick, I'm a volunteer, and I'm here to work with you on completing a personal health record. This is something that you can keep when we're done. Do you have time to work with me on this right now?" So it's really important for your question to be, do you have time to work with me on this right now? If you make the question, do you want to work on a personal health record? Well, most people do not want to answer yes to something that they don't have all the information about. So you'll end up having a back and forth discussion where you're trying to describe the personal health record, which is much easier to understand when you're actually filling it out. So just make the question about, do you have time to work with me on this now? And in almost all cases, the patient will have time to work with you. And then they can have their questions answered as you go through it together. The next thing to do, so following the guidelines on the header and footer section, is to sanitize your hands before you go in the room, and then sanitize them again after you go out. There's foam that you can use, sanitizing foam outside the room. When you're addressing the patient, always call them Mr. or Mrs. or Miss and then their last name. You want to always encourage them to write. So this is about them writing what is said between the two of you. If you go in the room and you say things like, "Who is your primary care doctor?" they'll tell you who their primary care doctor is. Rather, if you say, "Okay, here now you can write down who your primary care doctor is," then they'll probably write down who their primary care doctor is. So you want to minimize the amount of communication that's lost because it just happened between you and them, and it's not actually documented in the record. The more that the patient puts down of information into that personal health record, the more likely it's going to be recalled by them when they're in front of a doctor or a nurse, or a doctor or nurse will look at that part of the personal health record and get the information directly. So you want to also cheer them when they know something. So it's very hard for patients at first to get this. The fact that somebody's asking them to answer questions like what medications they're taking, or what their health conditions are, or how they self-manage these conditions. So it can be very sort of intimidating to be wrong about something, or to not be sure about something. And so you want to just cheer them for having an answer. You want to encourage them when they're not sure about something to ask. This is a new role you're teaching them, and the more positive energy you bring to it, the more likely they are to feel that it's okay to ask, and it's good to wonder. When you go through the personal health record, you do want to, at the turn of each page, say something personal and positive about that page. So this is the page where you'll put down health information and your follow-up appointments. I really like this page because it allows you to keep all your follow-up appointments in one place. So what I did is I started off with a one-sentence description, and then I said one sentence positive. This can become like filling out a tax form unless you bring your own personal take on why this is a good thing for them to do. If you just say, okay, now we're on the page with personal information, okay, now we're on the page with scheduling appointments, it will become dreary. there's a lot of great reason to fill out each of these things. And if you can reflect yourself on why this could be really helpful to someone and then put that in there in one line before you begin, it kind of gives them a little bit of inspiration in the process. When choosing a personal goal, you want it to be something that you could imagine them wanting to get out of bed to do. So if they say, I want to take my medications, who really wants to take their medications? If they say, I want to eat better, well, first of all, what does eating better mean? And why do you want to eat better? Like, why junk food is great, it tastes good. Why don't you want to eat junk food? So you really want to dig at them. Don't be afraid to take off the gloves and wrestle with them about their responses. You're a PAL, a patient activation liaison. You're not a doctor telling them, challenging them. You're wrestling with them to get at what they're really excites them. So it's you don't have to be afraid to challenge them, because you're trying to get at what they really value. And then you should ask, tell, ask. So if you're on the section about red flags, rather than say, a red flag is something that gives you a sign that your condition is getting worse and you need to do something. You want them to think about first. So ask them, what is a red flag? Do you know what that term means? And then they can guess something, and then you can say, yeah, a red flag is like a sign that your condition is getting worse. Or, well, let me tell you what a red flag is if they attempt it, or if you want to clarify something. You're much more likely to learn if you take a stab at something and then you can get in more information. And you're much more likely to respect the person who's talking to you. If someone just assumes you know nothing and just gives you all the information, then it's a little bit, it hurts the relationship when they don't sort of first ask you what you know. When a person answers the questions in the personal health record, you really want to take a second and say, hey, wait, let me just think about this. Let me think about how you answer that. Spend a lot of time on the personal goals. It's very easy for them to have glib, short one answers to these things that are not really at the heart of their motivation. And so don't be afraid to say, hold on, let me just hear what you're saying. And let me try to understand that, so that I understand that. And especially if you don't think something's right, say it. I'm not sure that's what this question's getting at. Be very informal and casual, because you're working with them to understand them. And so that's a very dignifying and positive experience. So even if you're a little bit abrupt in your challenging them, it's fun, because the truth that you're getting at is their truth. It's not that you're there to impose something. You want to make sure their answers are personal and specific. So if they say something that you could put on a Hallmark card, or you could imagine everybody on the floor saying, like, I want to cut down on soda. Okay, so everybody wants to cut down on soda. So why do you want to cut down on soda? I mean, soda is pretty good. It tastes good. It can give you energy. It's available. So why? Well, maybe I like to be I like how I look when my jeans are fitting me well and I'm not busting out of them. Okay, so that I understand so your goal is to look better in jeans, to have jeans that are not tight around the waist. That's something I can really understand someone who wants to drink less soda. I don't understand. I don't even know why that would be a goal or why it would matter to you. But there are very few people who can give you that answer of busting out of jeans. That's something that you got at, and that's personal and specific for them. That's the kind of goal that you want to find. And then help them to answer questions. So if they say, what would make me more confident about losing weight? Take a stab at it if they're really having trouble. Let me guess. Let me make a guess at this. So, would you be more confident if you had someone who you are meeting every day at lunch to do this walking that you're planning. So what is kind of fun about taking a stab at things is it brings all of your intelligence to the table, all of your sort of listening skills that you sort of were listening to how they plan their day and what their goals are. It gives the patient something really helpful as a thing to bounce off of. Well, no, that's not exactly what I'm saying, or well, yeah, that might work. So don't be afraid actually to attempt an interpretation of what they're saying, suggest an idea. The kind of relationship you want to have with patients is one where they don't feel that they have to say yes to you, but your suggestion is a sounding board for them, and they can sort of, you've reflected on what they've said, you've made an attempt to assist, and they are comfortable enough with you to say that you got it right or you didn't, and that could be helpful to them either way. When you do the SMART plan, you want to be able to visualize it. So if they say, I want to go walking every day, you want to go through it in your mind. What does that look like to them? So do you mean in the morning or at night? What are you going to do if it's raining outside? And where exactly you're going to go walking? And are you going to do it year round? Are you going to do it every day? What if you're not at home? So you want to be able to close your eyes and see them leaving their place of work, going outside, or driving to the mall if it's raining, and doing it inside. You want to walk through every moment with them. Again, this takes time, but what it will do is it will allow them to explain the process, and it will allow them to see visually any obstacles they might encounter and to think about and plan how they're going to go around those obstacles. So if someone just says, I'm going to walk, and then the next day they go out and walk and they realize that it's raining and they had not a plan for what they would do with their raining, they might just give up at that start. If you walk through with them these hypotheticals, you're preparing them to more likely be successful in the end. You also want to respect the patient and others around them. So you are the only person going into the patient's room who is not on a time clock. You can spend as much time with them as you want. If a nurse comes to the bedside or looks into the room and sees you're doing something, she'll say, okay, I can come back to do that. Invite her to come in right now and do what she needs to do. Nurses are great about giving patients and people in the room time and coming back, but coaches or patient activation liaisons will be there for an hour. And if we become an obstacle to patient care, it's going to affect our relationship with people in the hospital. So you want to always make clear to them that you'll stop and wait for them to do whatever they need to do. If a family member comes in, you want to ask the patient, do you want me to continue, do you want me to, or not? When food comes in, you always want to stop, because you don't want to put a person on the spot where they feel they're just thinking about food and they're asking you to leave. Nobody would want food to be cold, and so don't even give them that option of you staying around while their food's getting cold. Just let them know that you will ask them if it's okay for a pal to follow up with them later and get their information if that's the case, but don't persist while food is getting cold. The other thing is you want to really be cognizant of the patient's comfort. If they look like they're struggling in bed, you want to ask them, is there anything you can do to make them comfortable? If something is beeping around them, you want to ask them if they want you to get their nurse. You'd never want to feel like I'm pushing through this personal health record because it's my job, and beeping is going off and people are trying to get in the room and others are around them. Doing this is the least important thing in the hospital. It's between you and me, we know it's the most valuable thing that's going to happen, but it's not something that should be interfering with anything else that's going on. And the patient's comfort and your respect for that comfort is more meaningful to the patient than you getting through the record. So in summary, you should dress well to show your respect to the patient. You should review the header and footer sections before you enter the room. Always respect the patient and the environment around them. and be sure not to be an obstacle to patient care. Thank you.